Okay, we're continuing with Prevent and Reverse Afib and CHF by me, Pete Rogers. We're on something like page about 160. Okay, we're talking about stroke today. So here's the key diagram to understand stroke. This is the best picture you'll ever see to understand the concept of stroke. If you have a clot from the heart and it travels up here, it's going to plug one of these arteries up. So usually, clots from the heart will end up plugging up an artery in like the M2, middle cerebral artery, as it goes up around the convexity, and you get a stroke along the convexity of the brain. You can also get, posterior arteries, vertebral artery, emboli, and stroke the posterior fossa, but most common stroke is a middle cerebral artery stroke when it's due to a heart embolus. You can break off little pieces of clot from the common carotid, internal carotid artery bifurcation area and have little tiny strokes. Very common stroke is a hypertensive stroke where you sort of get a shear injury at the origin of the lenticulostriatus right here going into the basal ganglia. You get a little, lacunar means hole. You get a little hole in the brain. I see a bunch of those every day. But by far the most common cause of stroke is where the skull and crossbones here is. And those are due to a lack of blood perfusion, blood getting to this area of the brain, because it's an end artery territory, like a watershed territory, meaning that there's not good collateral flow in this area. So what'll do that? If you have severe hypertension, you'll gradually produce more and more atherosclerosis in these arteries. If you accumulate diabetes, you'll get blockage of these vessels. Also, if you overtreat hypertension, you can drop the pressure too low and underperfuse this segment, and you get little strokes in this area. I literally see hundreds of these every day, hundreds and hundreds of them. Okay. And so the Goldilocks balance is not too high, not too low. Oh, by the way, let me just briefly mention the anatomy here. Here's the basal ganglia. Here's the corona radiata. Here's the centrum semiovale. Okay, and that's the anatomy of strokes. I'm going to just, make this real short today. You want to memorize this picture. Hit the print save button and keep this picture. It's going to be useful to you for anything you ever hear about for strokes the rest of your life. This is how we grade all of them. Basal ganglia strokes are lacunar infarcts typically related to hypertension. Corona radiata level strokes in the periventricular white matter are typically due to hypoperfusion due to a combination of diabetes, hypertension, and overtreatment of hypertension. Strokes up here in the central valley are the same thing. Convexity strokes are usually embolic strokes, emboli from the heart or from the internal carotid artery. And that's pretty much the scoop on strokes. Okay, save that picture. We'll go into more detail in the upcoming lecture.